Cartilage injuries can occur because of an acute injury, such as a patellar dislocation, i.e. your kneecap goes out of place. And what this can do is just take a chunk of cartilage off. It can be something that just happens, and this can be especially in the teenage years, where part of the cartilage in the knee can just become loose due to an underlying problem. The other thing is a genetic susceptibility, so the cartilage is softer than one would normally have, and that can cause cartilage problems also. So it can be predisposed genetically, it can be the result of acute trauma, and those are the most common causes that I see of cartilage injuries. Again, in terms of how they occur, in terms of trauma, we've already discussed a common cartilage injury, which is when the kneecap dislocates. And as the kneecap falls off the side of the knee, the cartilage can just be scraped off. If you had a fracture of your bone that extended into your knee joint, again, that can disrupt the covering of the knee, which is this smooth cartilage. Cartilage is the equivalent of the gristle on the end of a chicken leg if you do eat meat. So it's a very highly specialized tissue which provides the ability for the joint to glide over each other. So any damage to it can lead to cracks, it can lead to potholes, and that can lead to pain. Obviously, the commonest cause of damage to the cartilage is just simple wear and tear, what we would term osteoarthritis. So as people get older, in some people, not all, but in some people, the cartilage slowly wears down, and that's one cause. In more rarer causes, the body attacks the cartilage itself, such as conditions like rheumatoid arthritis, where for several reasons, the body sees its cartilage as an enemy and then attacks it and then causes disruption. In terms of treatment of cartilage injuries, this all depends on how it occurred and also the age. If something has happened quite recently, then there is a small window in which you can screw large enough chunks of cartilage back. The other possibility for those people who lost their cartilage some time ago and they've got a specific area, what I would term a pothole, rather than a completely untarmacked road, you can fill that pothole up. Now, broadly, there are two different types of strategies for this biological type repair. One is to try and do an all-in-one procedure where you can either borrow cartilage from areas which are not involved in weight bearing, and you can take cylinders or bits of it and then just put it in a mosaic style in the defect, and that is called mosaicplasty. Or you can get different procedures but along the same line. You can then try newer materials which act as a scaffold for cells, get some cells from elsewhere in the body, concentrate those cells down in the hope that you can get in that few mils of blood of concentrate that you got, cells that can regenerate cartilage. You soak this scaffold and then you apply it within the knee, and hopefully tissue will form to fill in that pothole. Then the ultimate biological type treatment is when you take samples of cells from an area of the knee that doesn't bear load. You then send it to a lab. They grow those cells and multiply those millions of times. And then you, in the second procedure, implant them back into the knee. That's called autologous chondrocyte implantation. Predominantly, that is available at just a few centres within the UK, and I'm one of the surgeons that performs that operation here in Southampton. This is called autologous chondrocyte implantation. In terms of fragility, I wouldn't say the knee cartilage is more fragile than anywhere else. It's just within the sports that most people play, it's susceptible to injury and take the burden of injury more than other joints. But cartilage injuries can occur in the shoulder, in the hip, and the ankle. These are the other sites that are seen. But the knee tends to be more just because of the types of sports that the knee is involved in and the people that we see. In terms of treatment without surgery, then number one, biological age actually is one factor. So younger people tend to have the ability to recover from the minor injuries from cartilage. So if you see a baby skin, it's nice and soft and recovers well, whereas my skin is now getting to be all wrinkly, and cartilage is sort of acts in the same way. So the older one gets, the less ability it has to recover from the insult. Now, there are other biological treatments that are reported, such as injection of PRP, as it's commonly known, and people have also injected everything from fat cells to different types of compounds. Now, although anecdotally this might help, so far the scientific evidence in the literature doesn't wholeheartedly and clearly support these biological interventions. So there are there's more and more evidence of PRP being helpful. And certainly as an adjunct, again, there have been studies showing for it to be helpful.